Welcome to RSSDI TV 2020. I am Dr. Sanjay Kamble, and on behalf of Wockhardt RSSDI 2020, I welcome you all. I am glad to have with us today a renowned endocrinologist from Jaipur, Dr. Arvind Gupta. Dr. Gupta is a senior consultant and head of Department of Diabetes, Obesity and Metabolic Disorders at Rajasthan Hospital, Jaipur. Welcome, Dr. Gupta, to the show. Sir,
Thank
based on
you.
your recent talk in RSSDI 2020, we would like to know how common is diabetic kidney disease in type 1 and type 2 diabetes?
Diabetes, as such, we are facing in the world two pandemics. So actually, we are very problematic these days because we are facing twin pandemic of COVID-19 as well as the diabetes mellitus. Diabetes is increasing like anything. You know, at present, around more than 8 crores diabetes patients are there in the country. And as you have very clearly said, that diabetes is one of the important causes of death in the world as far as the chronic kidney disease is concerned. It is the leading cause of diabetic kidney disease, diabetes. Chronic kidney disease as such is very serious in diabetes as well as in hypertension. So, and I can say it is the 12th leading cause of death in the world. So it should be taken very seriously. As far as diabetic kidney disease, these days it is very popularly known as, because previously it was known as diabetic nephropathy. These days we call it as diabetic kidney disease. Diabetes affects in both type 1 diabetes as well as in the type 2 diabetes. Type 2 diabetes, of course, it occurs right from the onset of diabetes because these complications starts very early. While in type 1 diabetes, it takes around 3 to 5 years to establish the diabetic kidney disease. That's why we always screen the patients in type 1 diabetes, usually 3 to 5 years after the diagnosis, while in type 2 diabetes, we screen the patients right from onset of diabetes. Then actually annually we screen the patients for abnormal kidney functions. As far as diabetic kidney disease is concerned, let me say you the definition. The definition is very important. Abnormal kidney functions remained elevated for more than 3 months, and the abnormal kidney functions, they are either elevated serum creatinine, elevated urinary albumin creatinine ratio, and the reduced EGFR. Reduced EGFR means less than 60 millimeter. That is the EGFR. UACR 2.5 milligram per millimole in the men and 3.5 milligram per millimole is in the females. So if these abnormal functions remained elevated for more than 3 months, that is the definition of diabetic kidney disease.
So, sir, what are the preventive measures by which one can halt the progression of diabetic kidney disease?
Yeah. So before I go for the preventive measures, I want to reiterate in front of you, all the people, that there are certain high-risk population. These high-risk population gets the diabetic kidney disease little earlier. Like if the patient is hypertensive, if the patient has, say, uncontrolled diabetes, if the patients are obese, if the patients are having the family history of diabetic kidney disease earlier in the family, and because there are certain genetic factors which are responsible for diabetic kidney disease in the patients. So there are certain high risk population. These high risk population gets the diabetic kidney disease little earlier. There are certain structural and hemodynamic changes in the kidneys, and that's why, because of these structural and hemodynamic changes, the kidney actually functions less. And as we go old, as the duration of diabetes is increasing, As the patient's blood pressure is uncontrolled, as the diabetes is uncontrolled, the damage is little more, and that's why these particular high risk population, and I'm telling you here, very importantly, if patient is a smoker, this is the most important risk factor for development of chronic kidney disease and diabetes. So now we know that these are the high risk factors. And to remove these high risk factors, they are the most important preventive measures. First of all, the blood pressure should be controlled, and universally it is agreed with all the guidelines. They say blood pressure in diabetes should be less than 130 over 80 millimeter of mercury. By either ACE inhibitors, by ARBs, by calcium channel blockers, by any means, you have to control your blood pressure. Glycemic control again is an important thing, and you have to do the glycemic control in any case. HbA1c, if possible, it should be less than 7%. Then the lipids are again very important. So if patients have dyslipidemia, you have to give the statins. This is also important as far as the chronic kidney disease is concerned. So these are the major factors. There are other dietary factors. The dietary factors include, first of all, the overall calories should be the calories should be 25 kilocalories per kilogram body weight per day. After calories, then the carbohydrate should be around 40 to 60% of the total calories. The fat should be around 15%, and the proteins here is again very important. In chronic kidney disease and diabetic kidney disease, the protein should be around 0.8 grams per kilogram body weight. So protein restriction is there. Please mind it. I'm not telling you here, please stop the proteins. Indians are already deficient of proteins in their diet. So if you restrict more, he will go into the more in the sarcopenia. So protein restriction is there. It is not the stoppage of protein. So this is the first important thing we have to take care. So diet and the salt restriction, of course, for both chronic kidney disease as well as for the hypertension control point of view. So salt, protein restriction, calories, they are the major factors which can prevent you for delaying the complications, or if not possible, then even we can reduce the complications of diabetes, especially these microvascular complications, like it is a very dreaded diabetic kidney disease. Then we have certain drugs. If we are not able to control with the diet, exercise, yoga, and then we have to institute the drugs, especially I told you the ACE inhibitors and ARBs, if we give very early, they can prevent or reduce the diabetic kidney disease. Similarly, there are certain other drugs for the management of diabetes, like SGLT2 inhibitors. These days, we have found with the so many clinical trials that SGLT2 inhibitors can prevent or can reduce the diabetic kidney disease. So we have seen with the so many clinical trials. Other than SGLT2 inhibitors, there are new mineralocorticoid receptor agonists. They are known as MRAs in the form of finerenone. This is the recent, just a week before it was published, that this drug can prevent the occurrence of diabetic kidney disease. So, dear friends, we have to have a broader concept of reducing the diabetic kidney disease burden, right from your diet, right from your drugs, and right from your lifestyle measures. You can prevent the occurrence of diabetes, kidney disease in the patients.
Thank you very much, sir, for sharing your views, and stay tuned to RSSDI TV 2020 for more recent updates from RSSDI. Thank you so much.